Welcome, folks, to the MOA podcast. My name is Dustin Jones. We have a very special guest today. We have the one and only Dr. Lauren Young with NeuroElitePT.com. That's her handle as well. She's also a podcast host of the Rehab Remix. She's doing all the things. And right now, one of the things she's doing is opening up her own space. And I've been following her, watching from afar, lurking, and just seeing her share the wins, the struggles that I think have been very refreshing, because I'm also going through that right now with Hyphen physical therapy and fitness for folks over 60. So, Dr. Lauren, thank you for coming on. How are you doing right now?
I'm good. I am a bit busy. What business owner isn't busy?
Exactly. And for those that are listening, the video of this, she's in the middle of her clinic. Beautiful, beautiful space. What you see, if you're watching, this represents countless hours of hard work and dedication. And so we want to have a conversation. Anyone that may want to take the leap to own their own practice, whether you're focusing on older adults or folks that have neurologic conditions, that you have an accurate understanding of what actually goes in to all this. So I want to start, Lauren, if you don't mind, could you kind of share, was there a particular moment in your career where the light bulb went off of I want to do my own thing under my own brand? And if that was a particular moment, could you just kind of fill us in of what was the environment that you were in and kind of what spurred that light bulb moment for you to take the leap?
Yeah. Doesn't I want to say the name hyphen of your clinic? Whenever I saw that, I just thought it was so incredibly clever. So I just want to give you a kudos for the name of the clinic. I think it
Thank you.
encompasses like all of what we want to be, right? We don't just want to be that injury prevention. We want to take people into the next phase of their
Yes.
life and keep them moving. And so your clinic name is incredible. For me, as I'm sitting in my clinic, I never wanted to own a clinic. I think how many people, like all of the business owners that I've met, have all said that? The issue is you're sitting in someone else's clinic working 40 hours a week, and there's gaps. There's gaps that insurance just doesn't fill. And that is, I was in Kansas City working 40 hours a week at one job. I was teaching an anatomy and physiology course at a community college.
Dang.
I was adjuncting for a hybrid accelerated program, and I was working on the weekends at an inpatient rehab. My life was total chaos, and
Where was the 40-hour job? What
it was
setting?
called Ability KC. It was a outpatient day rehab, all
Okay.
neuro. It was a really unique situation, and I loved it. I love my job. I love my coworkers. But what I was seeing was everyone wanted more. People would be mad when you discharge them. And I'm like, yeah, I would be mad too, but I can't, there's nothing I can do because there was nothing. There was really no bridging the gap between discharge and the rest of someone's life. So in my head, I was like, this can be changed. How it can be changed, I'm not sure, but it can be changed. And so this idea was born. I knew I didn't want to own a clinic. So I was like, well, you go mobile. At the same time, there was another coworker who was there who had started something very similar. She was taking insurance. And so we just kind of chatted. We had these conversations. I knew she was doing it. My husband is an orthopedic surgeon. So he was in residency at that point. I knew we had one more move for fellowship, and then we were going to have a move to the permanent job.
Right.
I really didn't feel like I wanted to build something for a year. And so
Yeah.
I waited until we got settled. I'm in Lafayette, Louisiana. We got here and I was like, well, no time like the present. And I'll kind of tell you one of my first struggles was I had all of these relationships with PTs and none of them were located in Lafayette, Louisiana.
Mm.
So I'm like, how are people going to be like referred to me? Because I haven't taken the normal route of going to a physician. My clinic is kind of hybrid. It is a hybrid model. It's not kind of a hybrid model. I
Yeah.
just want to network with Medicare, but I started out only out of network. And in my area, folks don't love that. They want to be able to use insurance. So I found like in discussions with physicians, they were like, well, okay, not really interested in referring patients to me. So I thought, well, how am I going to get my name out there? And
Mhm.
luckily, I got involved with the Lafayette district and the APTA, and I met other clinicians. And now clinicians and clients are kind of basically my referral source at this point. So
Nice.
that was kind of a unique challenge that I hadn't thought about because I just basically was like, I don't
Yeah.
know anybody. And I'm now asking you to refer me clients, and you
Yeah.
don't know anything about me. And I don't know anything about you. And
It's
so hang on one second. Hey, hang on one second.
You're
Sorry.
good.
Sorry about that.
You're
Uh,
good. You're good.
People here early. So, yeah, essentially, I just didn't really have like a work flow or a source of patients whenever I moved, which was just challenging.
Yeah. So let's start there. So when you moved, you got settled, you're like, "All right, I'm doing this." We're in Lafayette. Did you start mobile or did you start in another facility? Where physically, like where were you serving people?
I was mobile in their homes. I started in a gym and that just didn't work out. People, the way they were using me, which was kind of not the way that I was intending, was they used it for intensity. So they went and used their insurance benefit 3 days a week, and then they would see me the other 2 days a week. So they would be getting 5 days a week of therapy while also using insurance benefits. So they kind of used a hybrid model. Cost was less for them. And then I, could kind of give like, okay, hey, here's what I'm seeing. Like, why don't you work on that on Monday with your other therapist and then come back to me with that model? That I just lost my train of thought. I basically found that as I was moving through, they were getting that they didn't want to go 5 days a week to another place. So the
Mhm.
fact that I would come to them was super, super helpful. So the
Right.
mobile model worked for me. I had another patient that I can think of woke up super dizzy one morning and she was like, I can't drive anywhere. And I was like, it's fine. I can come to you. So the mobile model is how I started, and people really took to the convenience, really, of not
Mhm.
having to leave their homes.
Yeah, 100%. So so why get a brick and mortar? Like what led you to that?
Yeah, it was truly a business decision. My town, the proper of Lafayette is relatively close together, but there are a lot of outlying areas where I was traveling 40 minutes to see patients.
Mhm.
I went in network with Medicare. Really, Medicare is what spurred the in person clinic. And that was just because the profit that I was going to make for Medicare, it didn't make sense for me to be mobile. There's so much time lost in travel that
Mhm.
you have to account for. And at some point, you can't raise your price to be high enough to account for the travel. So
Yeah.
basically, with Medicare, if patients are using their insurance benefits through Medicare, they come to my clinic. That cuts down on my travel time. My clinic space is 400 square feet. It's not big. I think everybody kind of was shocked whenever I told them how small it was. But I was like, everybody asked me where I was going to put my equipment. And I was like, well, y'all, I've been seeing patients in their homes
Yeah.
for 2 years. I haven't had equipment, like, and my outcomes have been fine. Like, I don't
Right.
need a bunch of fancy equipment. Like, would it be nice? Absolutely. But
Yeah.
I don't need that. That's not a need. And, maybe I grow, but this space was truly I wanted to keep rent low. I wanted to keep really my overhead as low as I could to maximize profit because we all know
Mhm.
insurances reimbursements are decreasing. I mean, I do think we got a 1.25% increase
Woo!
in Medicare. Yeah, to maximize that 40% decrease we've gotten over the last 20 years.
Yeah.
You know, like I don't expect insurance to have this huge reimbursement. So as I was looking for a place, I needed somewhere that made sense that you still can make a profit because at the end of the day, yes, we all want to help people, but this is a business. If I don't make a
Mhm.
profit, my doors can't stay open. And if
Right.
my doors aren't open, I can't help people. So I do take that kind of framework. So that's what spurred the clinic decision. Also, as a concierge PT, if you're within a certain radius of the city, I will come to you. If you're outside of that radius, the clinic kind of serves to
Nice.
cut down on that travel time as well. because
Yeah.
that's something that I didn't account for, again, as we're talking about like things that we really didn't think about. I didn't account for the travel time while
Yeah.
you're driving, and you can't get much done while you're driving. I do use comprehend AI like Scribe, so I can like write my notes as I'm driving. But if you're seeing one person, it takes you 10 minutes to dictate your
Right.
note, and then it's
Yep.
just dead time.
The the home health clinician's, biggest challenge
Oh,
is efficient
yes.
scheduling and travel. So, I wanna highlight just what you've done. So, for people that are watching, listening, that are thinking about this, the barrier what Lauren did, she lowered her barrier to entry, right? Alright, I don't need to go and sign a lease. I don't need to get my own spot. I can see people in their home and do mobile. Then, okay, let's sign a lease, but 400 square feet, like, you don't have to get this massive facility. You can have a very, very affordable rent that's gonna improve your margins right out the gate. And then the equipment burden. I mean, you don't need a lot, right? Like, so this a very efficient way to kinda get into that space when you don't want to drop a ton of cash, and I love that. From the payment sources, right? So you mentioned you would do, like, a cash pay rate. You're in network with Medicare. I don't know what reimbursement rates are like down there, but like where I am in Kentucky, you can expect 90 to $110 a visit. So kind of is it pretty close?
Yep, it's
Um,
similar.
and so your cash rate, 125 is I saw
Hmm.
on the website. So
And it needs to increase. So
yeah,
everyone listening, it needs to
yeah,
increase.
right. And
I'm
don't feel
actually in
bad
the
about it.
process of that.
Yeah, don't feel bad about, because some of y'all may say, "125, my gosh." Well, there's people that are much less qualified charging a lot more, right? Which doesn't immediately make it okay, right? But you are very valuable. The out of network. So were you billing people's benefits out of network? Or just when you say out of network, you say you were just doing
Yeah,
cash?
cash pay.
Okay.
Yep.
Okay.
Yep. And that's
And
what, I give people super bills. They're able to go and take, of course, I think we'll probably get here, but there's the whole Medicare conundrum, which is why
yeah.
I'm in network with Medicare. But all other insurers, the Advantage plans are a little different. But the other insurers, you either have out of network benefits or you don't. For a lot of my people, like we were talking, they're already maximizing what benefits they have and then also coming to me. So, yeah.
Yeah. And then with the cash pay folks, do you have any like recurring models? Like they pay you every month a certain amount for X number of sessions?
I don't have anything like that. I played with that at the very beginning, and what I
Mhm.
found was people were a little skeptical to come in and say like, "Yes, I want to do this 10
Yeah.
times." Or, at whatever frequency I set. They would have rather paid session by session. I think I do have some folks now who I could transition into that model if I wanted. But someone told me one time, you're either selling packages or you're selling sessions. And so it's like,
Mm,
at some point, like how are they really that different? And I really had trouble with the sticker on a package. People would
mhm.
see that price and they're like, well, hold on, why
Yeah.
wouldn't I go use my insurance?
Yeah.
And I do think that I believe a lot of rural areas probably, and I know I'm not rural, but there is a lot of rural outlying and that kind of mindset, limited access to care in this area. So I think a lot of rural areas have people just have trouble with that
Mhm.
thought of my insurance pays for this, but I'm going to pay cash
Yep.
for something that is a covered benefit. A lot of my colleagues and friends who are doing this in big cities.
Mhm.
And so I think there's a little bit different of a mindset that people are willing to pay, and I have a small subset of people who are willing to pay and see the value in it. But I would say overall in the community, it's been very difficult to say your insurance pays for this, but
But
you should come to me.
yeah.
And that's where the hybrid model of them going somewhere else and then coming to me came from. And it's also part of the drive of why I'm going in network because I was sending so many people to other places. And it's like, whoa, at that point,
Yeah.
I could be keeping these folks to help them because I don't think there's another person with an NCS within 100 miles of where I
Mm,
live. And so there's not a clinic that's specialized in neuro where I live. There's some clinicians who treat neuro, but they also treat low back pain and hip pain. And again, that's what comes with being in kind of a rural town is you have
mhm.
to be able to treat everything. So I think the lens that I bring is that I have the access and I am the specialized care. Neuro is all I've done for 10 years.
Yeah,
So I think that's
and that's
unique
valuable.
and I think it's a service that a lot of people need in this area.
Yeah, and I like how you're able to broaden your net, right, by going in network with Medicare, but then you're also there's folks that probably have a good bit of discretionary income that they are willing to pay you, and broadening that is gonna be really helpful, and I think for
Yes.
folks that are especially in these realms where, we are working with a lot of older adults that may be on Medicare, so we cannot take cash for, physical therapy services.
Mhm.
The profit margins on a Medicare visit are slim, right? We mentioned 90 to $110 a visit, and then, you gotta take off rent, if you bought equipment, payroll, subscriptions,
EMR.
softwares, yeah,
Yep.
all that type of stuff. Like, there's not a ton left over. But when you have these other revenue streams that can offset those low profit margins, then you can have a viable business. And for us at Hyphen, it's more of the fitness side of a gym membership and personal training as well. But that other revenue stream that's usually more consistent and
Mhm.
reliable can help you weather the storm of the Medicare visit where you're not making a ton of money from that situation.
Yeah,
Um,
absolutely.
that's awesome, and I love the 400 square feet, like, so efficient, and that
Yeah,
is a beautiful thing. What's wild to me now after ours is 1,600 for which for a gym and 2 treatment rooms, that's pretty tight, but,
yeah, yeah.
you know, I know exactly how much it all costs, what it took to build those walls, put that drywall up, paint those walls, like, I know what goes into this now, and, I'll travel most weekends into other clinic spaces, hospital systems, and I'm just walking around just, like, calculating, "Alright, you've got 5 new steps, you've got 3 treadmills, you've got all these" like, I mean, all the things that, like, we as clinicians, we take for granted. I mean, these facilities we're approaching in the millions of dollars in terms of fit up and equipment, but just know you don't have to do that.
And it changes your perspective too. Like my
Mm,
perspective, I understood as my bosses were telling me we need to do this to save revenue. Like I conceptually understood it. But like seeing it on paper of if we change out this piece of equipment for the off brand that still does the same thing versus the name brand, our profit margin grows. And, there was this, I remember working and there was this big push that we didn't give everyone TheraBand. And it's like, what do you mean we don't give everybody gets one TheraBand? And I'm like, that's so ridiculous. And now I'm like, here's the Amazon link to TheraBand. If you want some, you go buy some, right? Because the profit margin is so, so
Yeah.
low. And I operate as a for profit institution. I have started looking into changing to a nonprofit institution in the neuro space. That's what a lot of people are doing.
Mm,
If they're not, as you're trying to do this hybrid model of
yeah.
insurance and not, that's probably a whole different discussion. But is a for-profit institution, your overhead is your overhead. Like you've got to meet those numbers. And like you said, you see these. I walked into a clinic that was just recently built. It was a sports med clinic. And like you said, it's got hack squats, it's got the Rogue squat machines, it's got it had floor to ceiling roll top window doors. And I'm like, this is gorgeous. But I'm also like, they're a hospital system that this is nothing to them to build.
Right.
And I think hospital systems have great clinicians in them. I'm not saying that they don't, but I am saying there is a different level of access you have to me because I have 400 square feet with limited equipment. Like when you call, you're going to talk to your physical therapist.
Yep.
it's not going to be the same in a big system. And I think it's what you value. There's some people who want the fancy and shiny equipment, and I'm not the place for you. And I think this is what I want everyone to hear and really try and soak in. You don't have to be for everybody. You have that person out there who is your ideal client. And my ideal client is someone who walks in and understands the value of what I bring to them is my knowledge, my expertise, my framework. It's not these four walls. And
Mm,
so, or the walls in their home. The value is I care about you and I want you to get better. And I don't have 40 patients on my schedule. So I can devote the time to you that I need to devote to you. I mean, you look at
preach.
what you have to do for a patient. I have a patient coming in later today, and her foot is contracted at almost 68 degrees of inversion. I've had to call PM&R
Gnarly.
physicians, neurologists, orthotists. I mean, I've spent probably at least 2 hours on the phone with all of these people trying to coordinate care. In a hospital system, that looks very different. You have 8 people who might need that same level of coordination,
Mhm.
and there's not enough hours in the day. And if you do it, I can speak from experience, you're done. You're burnt out. You don't have
Yep.
anything left to give to your family when you come home, like to you. So I think that's the beauty of this model. Are there things that I don't have? Yes. But are there things that I value to give to people? Absolutely yes. And I would do this every day of the week. The fancy equipment will come. That's what I keep telling myself.
I love it, and it's intentional, right? And I think
Yeah,
for folks that are watching or listening, Lauren's made very specific decisions to allow the freedom to practice the way she wants to practice and serve people the way she wants to serve them. And there's
absolutely.
so many ways that we can get into this game. And I think what you have done and are doing makes this very approachable. I think it makes it very exciting for a lot of students and also a lot of new grads that know they may want to do this at some point. So I hate to wrap this up right now, but Lauren has a patient waiting
At
right
some point.
here, in her lobby. So crush it, change some lives. If folks want to learn more about you, your practice, your podcast, where can people find you?
Yeah, if you just follow me, it's NeuroElitePT on Instagram. That's where I have my biggest presence. I am unfortunately on there way too much, but I will answer any DMs, anything like that. We're putting together through the podcast, basically a framework of how you create a side hustle because that's how I started. It was a side hustle. I had a full-time job. I think Dustin, like you said, these students and new grad clinicians, I don't think it's always you have to go out and have all this stuff. You can start if you protect yourself with, whatever business structure you want, the legal protections, you're practicing within your practice act. You can see 3 or 4 people every week out of network after clinic and slowly build until you're ready to take the step to leave the clinic to build your own thing. I think oftentimes it's either I'm working 40 hours a week for someone else or I'm running my own
Mhm.
practice. And I think it can be either or. I don't think it
Yeah.
has to be a both and
Mhm.
situation. Or sorry, it doesn't have to be an either or situation. It can be a both and
Yeah.
situation. You can work for somebody else while building your business, while building your brand. I think that is one thing that I look back on and I wish I would have done sooner because I think there was a way to do it. I just didn't know how. And so now
Mhm.
that I can kind of take that lens, that's something that I hope to pass on to other folks is you can do it. You just have to be intentional with it and protect yourself, right? We all have a
Yeah.
license that we can't we don't want to be revoked. And so you can do it. It just looks different because not a lot of people are doing it. But we have to push our profession forward and we have to start leveraging our knowledge with our value.
100%. 100%. Well, I appreciate you sharing that, sharing your journey, being very transparent. And yeah, y'all need to follow her if you don't, NeuroElite. PT. I'll put links to all this stuff, the Rehab Remix, the clinic site, Instagram, but be sure to follow because she's sharing all the good, the bad, the ugly that comes with opening up. There's a lot of good, right? There's a
A
little bit
lot
of
of
bad
good.
and ugly, but a lot of good things. So
Yeah.
thank you for your time. Thank you, patient that's waiting for your session. Y'all have a good rest of your day. I appreciate it.
Thanks so much, Dustin.
Awesome.